Good evening, everyone. I am Rabbi Idit Solomon. I am the founder and CEO of Hasidah, and we are joined tonight in co-sponsorship with No Shame on You for our program about mental illness and infertility. So first, I do want to allow Wendy Singer, who is the Director of Programs from No Shame on You, to share a word about the organization.
Thank you so much. Yes, I'm Wendy Singer, Director of Programming for No Shame on You. Our organization was founded in November of 2014. No Shame on You is a nonprofit organization dedicated to eliminating stigma associated with mental health conditions and raising awareness of that in the Jewish community and beyond. Our goal is for the people who need help to seek it, for family members and friends to know how to provide proper support and save lives. And we do that through a variety of different types of programming, such as programs like Tonight, community outreach programs, small group engagements, workshops, daily online resources and tools, a bi-monthly podcast, distribution of fact sheets and other crisis information resources, and when it's non-COVID time, appearing at parades, festivals, and fairs. Since the pandemic, we're proud to have offered over 225 free virtual programs, and through our 120,000 social media followers, we share information and resources weekly. We also have a blog and a podcast. We will share information about our organization at the end of the program, and I'll also give my email address in case anyone has any additional questions or needs anything. I want to give a huge thank you to Hasidah for all you do for the Jewish community, and it is an honor to partner with you on this evening's program. Thank you.
Thank you so much, Wendy. It's really a wonderful partnership here. Hasidah is, our focus is on infertility in the Jewish community. And we also offer grants and loans, and we offer emotional and spiritual care. And in addition to our meetups and spiritual care resources online, one of the things we do are programs like Tonight, where we have experts in the field help us learn about different aspects, and the intersection of mental health and infertility is quite an important thing for us to consider. So I would like to introduce our two speakers for the evening, who are both really experts and leaders in the field. First, we have Dr. Bill Pitock, who I would say hails from Maryland, but I think I would just say that again and again tonight. Bill has worked in the field of infertility for many years, since the 80s, and he has been on the board of other organizations, including Path to Parenthood, and has chaired other professional organizations, including in the American Society for Reproductive Medicine. He is a licensed psychologist, and his specific focus, which we have worked with him before, is also on male infertility, but he knows about aspects in all different areas. He also has trained other therapists, works on films and training things. He is, I shouldn't have said hailed from Maryland. In fairness, you are originally from Detroit.
I am indeed.
For that, right. As a Midwesterner, I have to give credit where credit is due. And I'm really happy to have you here tonight. And you are joined together with Dr. Julie Benderman, who also is in Maryland. And one of the things that is very exciting about Julie is she recently just published another chapter in a book. And so I can say she's an author of several articles and chapters now in books. She is an authority on the psychological treatment related to reproductive challenges, infertility, pregnancy loss, postpartum, and more. And she is the co-founder of the practice where she works, the Integrative Therapy Center of Greater Washington. And we have also worked together on many issues. And one of the things that's also unique about both Julie and Bill, is that they specifically also have looked at the intersection. We're talking about the intersection of infertility and mental health, but tonight we're also going to delve into the specific areas of religion and infertility and mental health, because not only do we have many identities, but we can experience a mental health issue and experience infertility, and we're Jewish, and these are all related. So the way the format is going to work this evening is I do have some questions for our esteemed panelists to address and discuss. We can just have a conversation. We do have some questions that were submitted in advance, so I want to make sure that I'm going to bring those up as well. And then if any of our listeners want to enter something in the chat, they can send it to Ariel or they can send it to me. We can also answer those questions. But maybe just to get started to have this topic, I know one of the things we talked about in preparation for this is that when we say mental health, it's funny, when we say infertility, what do we mean? When we say mental health, what do we mean? We talked about the fact that someone can, for example, infertility is tough and you can be sad about it, or you can maybe have a depressed feeling, but that's also different than having depression. Can we first just maybe start by talking about, just so we know what we're even talking about here, what are we talking about when we say mental health? What are the things that we're looking for in the areas that may come up in infertility?
I guess, and Julie will follow on, I guess probably the two biggest things that we see are depression, as you mentioned before, and anxiety. And frequently anxiety is a component of depression. So it wouldn't be unusual for somebody who's struggling to build a family to be very sad about that, and to be very anxious about all of the procedures and the waits and all of the things that are taking place in their journey to create a family.
The distinguishing feature between what we would consider to be expected reactions to a fertility journey versus something that's more of a clinical indication is depression and anxiety interferes with one's daily functioning. So depression might be something where you can't get out of bed, you can't function at work, or anxiety, the same kind of thing where you're just paralyzed, unable to make a decision. And that's more of the clinical kind of presentation. That's really different than, oh my gosh, I'm about to go in for retrieval. I'm worried that I'm not going to have enough eggs that are retrieved, or I'm worried that we're not going to be able to create enough embryos, which I would say that's a really expected reaction to the situation that you're encountering.
To really, piggyback on that, that's a normal reaction. If your dog died, you'd be sad. If you're, dealing with one of these challenges, you could easily be sad.
So talk to me a little bit more about that. First of all, normal is a huge, wide range. That's one of the things we recognize. Like, it's kind of hard to, like, this is not normal. This is maybe normal versus something that's clinical. But maybe that's really helpful, because I think that many people here, and I can speak from my own experience, again, I don't know if I wanted to be normal, but I just wanted to know, like, if is this what I'm experiencing? Like, okay, so what should we think about when we're thinking about infertility and mental health? What is that range that is we're not necessarily to interfering with daily function, but what are some of the things that may interfere with my function today? Or what could be in that range of to be expected? I think, Julie, that was your word. What's to be expected?
Yeah, so I think, when I'm thinking about these typical kinds of reactions, responses that I see from people that I work with and others that I know that have had some kind of fertility challenge, one of the things that I see that is typical, that's expected, that's normal, whatever word we want to apply to it, is it's hard to be around other people who are pregnant. It's hard to go to brisses. It's hard to go to baby namings. It's hard to go to events like Rosh Hashanah, where you're seeing all the families that are there at synagogue. Those things are hard. And so there is a very usual, typical, normal response of, I don't want to go. And so I want to name some of that, because I certainly know a lot of a lot of couples will have different perceptions about this, where one person is like, I don't want to go, that's really painful. And the partner might be like, but we've got to go because this is what's expected of us. And you just do it and don't think about it. And so that sort of disavowing of, wait, actually, that is a typical reaction. We do want to protect ourselves. And one way to protect ourselves is to avoid, especially if we don't know if someone's going to say, gosh, you guys have been married for 5 years. When are you going to start having kids? And these are all the kinds of social situations where these types of questions get asked. Or, oh, are you going to give someone, your child a sibling soon? Don't wait on that. All these kinds of, I hope well-intentioned, but I know they feel like knives to the heart. So the anticipation of, oh, I don't know what I'm going to say. I don't know how I'm going to be. That's what I would consider to be a typical anxiety or typical depression of, oh, I don't want to have to deal with these questions. And so a response to it might be to avoid. All right, Bill, I'll let you talk.
And I think what Julie, the little example you gave before about, I can't deal with this, I don't want to do it. No, but we have to, would sound like a very typical conversation between a man and a woman, with the man being come on, we got to go do this. We have to tough it out. That's what we do. And without being too stereotypical, it's, guys are very good at utilizing denial as a coping mechanism. And there is something to be said for that if it works. The problem is, and I'm sure people who are listening are in relationships and thinking about, but wouldn't it be better if we were unified about this? And of course, in the best of all possible worlds, we'd all be on the same page with our partners at the same time always, but that world doesn't exist very frequently. So it's not unusual for somebody to be here and somebody to be there, and they both care very deeply about each other, but it feels like you don't understand me, which can heighten that gap a little bit and make the emotional reaction a bit stronger.
And also then heighten that sense of this must not be normal if my partner, who is the only other person living this with me, is unable to understand me.
Correct.
So that's actually a really great point. And I'd like to delve into that different. I think sometimes, so partners in same-sex or heterosexual couples, either way, could have a dynamic. And we do often look to our partner to kind of normalize what we're doing or mirror that. What are your thoughts about, like, when your partner was someone who maybe is not handling it well, or you don't think it's handling well, or you're not, and you're not getting support? Can you talk a little bit about that dynamic of the mental health issues in relationship?
So when we encounter fertility troubles, I know that the easy way of thinking about it is we come to this crisis as if we've never experienced anything else in life, that we've had these perfect lives up to, and this is the first crisis. And typically this is the first crisis for a couple. And so it means that, oh my gosh, we're in crisis mode, and we each come to crisis with different coping mechanisms, with different understandings, with different responses, with different reactions of that crisis. And so now we're meeting this moment, and maybe we're on the same page, but most likely we're not, or at least, as Bill was saying, not at the same time, we're not on the same page. And so that can complicate things too. We don't think about infertility as something traumatic, but I like to think about it in that way. It's a moment of crisis. It's a moment of many traumas, because for most of us, it's not one IUI cycle and we're done. It's okay, we have to get an evaluation, and what is that like to have somebody else look at my body? And especially for women, because our reproductive organs are internal, those tend to be pretty invasive kinds of evaluations just to get a lay of the land. And so between that and all of the procedures and coming to it over and over again, we're on this roller coaster that can feel really traumatic. And when we're encountering trauma, we bring our past responses to other kinds of situations that might have yielded some similar feelings. So if we are feeling this hopelessness, I'm never going to have a baby. Sure, we've never encountered that I'm never going to have a baby situation before, but we have encountered hopelessness. And so we're bringing to the table our version and our story of what hopelessness has been in our life. And our partner might be bringing their version and their story of what hopelessness is like in their life and how they coped with it, or what they were taught about it, or how they protected themselves about it, which is really different than how I might have learned about it, or how I might have coped with it, or how I might have protected myself with it. So these are some of the dynamics, just to sort of get into it a little more, that become really challenging because we all bring with us our own stuff to this moment, and we use that stuff to build on how we then survive this moment.
To add on to what Julie said, if she mentioned this is usually the first significant crisis that a couple faces. And usually that's, let's say it's within the first 5 years, unless they got married really young and decided they wanted to have kids a little bit later. So it's in their first 5 years. And if you think about how long it takes to learn how to dance with somebody in a marriage or in a significant relationship, it's usually more than 5 years. You're just barely scraping the surface. And of course, you haven't had conversations about, or probably not had conversations about, tell me your worst crisis and how you coped with it, so I'll understand how you manage those kinds of things. The other side of that is, and Julie alluded to this, that while this may be the first period of hopelessness or the first period of significant anxiety about this and this kind of a trauma, you've dealt with other things before. We've all gotten to the point where we've gotten married or in a significant relationship by virtue of having solved some sort of problem. The most logical one here is who to spend presumably the rest of my life with. That's not an insignificant problem. That requires a lot of decision making. But now we're confronted with a very different set of conditions and decisions that aren't based so much on the heart, but now science is getting thrown at us, and decisions about protocols, and decisions about donor choices, and decisions about procedures, which are well beyond what color should we get for the drapes, and do we want to have an indoor or outdoor wedding? Usually those are influenced by parents. And to add to this, in the mental health issue here, parents are, if they know what's going on, being influential, even if it's only subtly. And so that can add to the anxiety because most of us really do want to please our parents. And sometimes we don't want to talk about what's going on because it's awfully private. By virtue of it being reproduction through sex, we're now asking, we're now saying, all right, I'm going to let you in the bedroom, which for most of us is really an uncomfortable place to allow anyone other than the person we're sharing that bedroom with.
Excellent points, followed by big very excellent points. I'm so processing what you just said, and I'm thinking about that in as much as, so I'm going through this, and this is how I know to cope with these things. So you have two things going on. I got to figure out, like, I'm hitting this crisis, and I may have these mechanisms that help me try and manage this trauma and my own mental health. How can I understand, like, if I need to seek help, or how do I know? Like, they're not dealing it the same as me. I think what you bring up is exactly true. Like, even like they're laughing about right now, and I get it that that's their coping. They're going to make jokes, but right now I really just want to cry and go in a hole. How do I know when I need to seek help, or we need to seek help? When do I know that this is just how I cope and this is okay? And maybe this is how I cope, but it's not okay anymore.
I think the best analogy is that it's probably always okay to talk to somebody else when it's something you don't know enough about or want to understand better. You mentioned that I grew up in Detroit. Well, just because I grew up in Detroit doesn't mean I know how to fix my car. I don't. And I think if you start using an analogy like that, okay, I've never been in a situation like this before, either dealing with fertility or the first time the two of us have to face a challenge which we're thinking about differently or approaching differently because we come from different places. It would always be appropriate to talk to somebody. Because you talk to somebody about a challenge like this does not mean you are emotionally disturbed. It may mean you have some disturbing emotions, but seeing a professional is not a diagnosis or a reason to feel shamed. And I think, the fact that this is being co-sponsored by No Shame on You speaks really well to that point. This is a challenge which many couples face on a yearly basis. Just to throw some statistics at you, the last year we have data, which was 2019, it's validated data, there were 278,000 cycles of IVF done in the United States at SART clinics. That's the Society for Assisted Reproductive Technology. That's about 85% of the clinics in the country. Of those 78,000 cycles, 75,000 babies were born. That's a lot of not babies being born. It's also a lot of babies being born. This is not an unusual problem. So, there's somebody else out there who's got some knowledge who might be able to help you navigate both the medical as well as the psychological components of this.
And just to put it in perspective, in the United States, there tend to be every year at least 1 million babies that are born. So we're now talking about nearly a quarter, or at least a quarter of the people who want to have babies are going through fertility treatment. And then you have that, I round numbers, 10%, because we're going to do round numbers, of those babies that are born in a year are born via assisted reproductive technology. And that's not insignificant.
And that number doesn't count those donor inseminations that don't get recorded in an IVF clinic. So we're really talking about closer to more than 10%, maybe 12 or 13%.
Yeah. And so I want to also recognize that when we talk about mental health, we do have a connection between our mind and our body. We'll get to soul in a little bit also, but I do want to take a minute to address that about your thoughts on just kind of that connection. Where is, I'm not even quite sure I quite have the connection, because it's a loaded question, in as much as like, how can our body help us inform us? What do we need to know about our bodies and this connection to our mental health? Because the infertility, going through anything in a clinic or any of these medications is tough on a body. And any type of trauma or struggle with mental illness or just a mental health issue can also, we kind of forget that that is part of our body. So talk to me a little bit, talk to us, talk to everyone here a little bit about that connection in our bodies, what we can look for, what we can expect.
So I want to, if I want to jump in first of all, Bill,
Sure,
but
please.
I want to myth bust something, because I think what we hear a whole lot from people is just relax, take a vacation, stop thinking about it, and you'll get pregnant, which implies that stress is a major cause of infertility. And we just don't have the data to back that up. But what we do have the data that backs up is that infertility is a major cause of stress. So that is a true correlate. I think there's a lot of, where I see a lot of the mind and body come into this is this feeling of shame and blame on a body that is being perceived as not working. And again, having to go through the medicalization of having a baby, which is very different than how we imagined it was going to look like.
Mhm.
That too is where some of that intersection between mind and body is. But if the only takeaway you take away from tonight is just please know that your stress is not causing your fertility challenges.
Let me double down on that. If we were having this talk in the 1980s, there would be people who would say, well, some infertility is psychogenic. That means it's caused by an emotional condition. There is no data to support that whatsoever. And so it's not that just relax or when you are ready, you'll be able to get pregnant. It doesn't work like that. There is a certain percentage of infertility which is unexplained. We can't say it's the result of endometriosis or poor sperm quality or complications with the uterine lining, but there is no evidence to suggest that infertility is caused by any psychological condition. Now, to add on to Julie's point, infertility treatment and infertility itself is very stressful. So reducing stress is always a good idea. And there are many things one can do to reduce stress. There are multiple books written on this. We have a colleague, Dr. Alice Domar, who's written a book where the first half of it deals with stress reduction techniques that are not crazy. You change it. Her point is do things in moderation. You will help yourself. So don't go and run a marathon, walk around the block for starters. Don't go on a 1,000-calorie diet. Just get the whole milk out of your diet and put in 2%. Those kinds of very logical things. And do things which will help you attain some level of calm, knowing that you're not going to be blissed out while you're going through this. That's not going to happen. That will be helpful because we know that chronic stress has an impact on overall health, and that means the body.
We also know too that one of the challenges around infertility treatment is that we don't have a crystal ball to let people know, okay, for you, it's going to take 3 rounds of IVF, but for you, it's going to take 5 rounds of IUI, but for you, yeah, you got to stick around. It's going to be 9 rounds of IVF here. And I wish we could have that kind of crystal ball. One thing the research also bears out is that people who are able to stay in treatment, and I say are able because there's so many factors that might cause somebody to drop out of treatment, but people who are able to stay in treatment, that the more rounds they do, the higher percentage overall is their likelihood to get pregnant. So being able to manage the stress of treatment is an indicator of people being able to stay in treatment and thus potentially take home that baby.
And to go to your question about what can you do? Well, in terms of when should you seek counseling? Well, if you find that your stress levels are very high and you need some help learning how to manage that while you're going through infertility treatment, that would be a perfect time to talk to somebody who can help you with stress reduction techniques.
And I think there's a distinction between mental health professionals who can help you in general with stress reduction techniques and mental health professionals who have a deep knowledge and understanding of the infertility process and what that all means and what those intersections are like. And so just sort of knowing who you're talking to, because I've certainly had the experience with clients where they come to me and they're starting to explain what's happening. And I'm like, yeah, no, I get it. So tell me, what's your protocol? Tell me what antagonist you're using. And they're like, oh my God, you really get it. My last therapist, I had to spend most of my session educating them. And so that takes away some of the stress when you're looking to receive assistance, because it's no fun to have to be like, okay, let me tell you what this is about and what it is. I don't want to be the expert when I'm coming in looking for assistance. I want to be taken care of.
Most of us go to an ophthalmologist when we have eye problems. We don't go to a kidney specialist. And I think Julie's point is really good. You want to see somebody who has expertise and training in the very specific intersection of infertility and mental health. The resource for that is the Mental Health Professional Group of the American Society for Reproductive Medicine, asrm.org. You can search for mental health providers. Julie and I would be remiss in telling you that we're both very proud members of that organization. So this is a shameless plug for that group. But the critical variable here is someone who understands fertility and fertility treatment and is well schooled in mental health techniques.
So I want to jump in there too. First of all, this is not to make light of it, but to promote it. This is a no shame on you zone. Like, ask for help, and I put that link in there. That's a great. That is not. There's no shame. Plug help. It's a very good thing to ask. One thing that I actually just was very curious about when I was in the throes of this, I had a friend who was facing breast cancer. And there was actually, oddly, a lot of similarities we found, both like in what you just brought up about this connection between mind and body, in part because treatments are invasive. It was about reproductive parts of our body. One of the things, though, that I was thinking about in terms of the stress, when you were talking about the multiple things, is one of the things she and I experienced, and I'm curious about this, is we also felt the effects were cumulative. Like, her fourth round of chemo was similar to like the fourth IUI or the fourth IVF. Like, it wasn't just going back for the same thing. So I hear when you say, and you're both nodding, I hear what you say about, the more you can maintain the stress, the I don't know if you want to say the better chance you have of getting through, but I'm just wondering, if just one last question on this mind body thing, if you can talk about those cumulative effects, because it was harder on my body and harder mentally, and about that kind of just that cumulative effect of both the mental health and the physical health.
There's, when we talk about, and I mentioned earlier how our past experiences with hardship, our past experiences with different feelings, or past experiences with different traumas, how those two are cumulative. We build on those experiences. So exactly what you're saying, that fourth IUI cycle is not, yay, we're doing IUI, cool, we're going to build our family. That fourth IUI cycle is, I can't believe we're doing this again. Okay, we're doing it medicated. Okay, I know what that means. Oh, do I even have a place on my body that's not going to hurt in order to inject the medication each night? Oh, I look at my stomach, it's so bruised. All of these different pieces are that accumulation. And that's also this piece where I say, this is this repetition of trauma, right? This is not, oh my God, I'm shocked to the system. And what are novel ways of managing this? This is, I sort of go on automatic pilot because my body knows how to respond for better or for worse. And my brain knows how to respond for better or for worse. So that might be, it's my fourth time, I'm feeling now more depressed, or I'm feeling more anxious that this is never going to happen for me. So that cumulative effect for both mind and body is really, really important. It is why people they feel really hopeless about attaining that dream. It is another reason that people might drop out of treatment, because it's just so hard. And it shouldn't, I put that in quotes because what is should and shouldn't, but shouldn't be this hard. It's not supposed to be this hard.
Right. We think that when we do things over and over again, it's like practice, so we get better at it. This is not something that anybody wants to practice or get better at. And that cumulative effect isn't building muscles, it's building calluses. And, those calluses are uncomfortable. And even with the right shoes, it's going to feel funny when you step down, if I can use that sort of a metaphor. It is cumulative on the mind and on the body. Doesn't get better.
It's a marathon, not a sprint.
It is totally. So I want to use that to twist to kind of like the last question, and then I want to turn to some of the questions that came in. But in that cumulative effect, it also leads to the the detrimental effects it can also have on our spirit and our religious views. I have found that many people who call Hasidah in particular call because there's a familiarity, like they want to be in a community that feels gets them. And a lot of people have theological questions that they're asking, and sometimes they don't even know that that's what they're asking. And there is a lot of this when, like, what did I do to deserve this question? I always recognize what people don't realize is that implies oftentimes that there's something external to me, God, divine, other spirit, that is punishing me. And so we all sometimes also forget when people talk about this punishment, a lot of times it's theological and they don't realize that they haven't explored these issues. I'm wondering if you can talk about either some of these type of questions, not just to name them, but also to help people understand what they may mean and how to have a perspective on them, as well as just anything like, this is we're a Jewish group here, this is a Jewish event. And just any of the context, I guess I'm asking two questions maybe at once, but what's Jewish about this? And these questions and how do we deal with them? So in either order to address those, I think that's really important about why we're here.
Well, what's Jewish about this? I'm gonna say a little bit, and Julie's gonna talk a lot because she's just written a chapter about the intersection of religion and infertility, and as well as the little a part of the sex part that goes with it. But infertility is very Jewish. I mean, it shows up in Bereshit. I mean, Sarah has trouble conceiving, and she's not the only one. There are multiple stories about women who have difficulty conceiving. Unfortunately, there aren't any stories about men, even though likely there were men who had difficulty conceiving. Well, that's another story. So this is very Jewish. And I think, and Julie will elaborate on this, it would be nice if we would have someone to say, this is the reason why this is happening. It's X fault. It's because I did Y event. And unless you did something which damaged your reproductive system in some way that you did voluntarily, then there's probably nothing that you did. And it isn't someone else punishing you. It is in some ways sort of existential as a question. And it would be so much easier if you could say, it's because of this. But remember what I said earlier, about 10% of infertility is unexplained. That means we can't explain it, just flat out. So Julie, why don't you jump on the Jewish part there?
Absolutely. I think too, what's important that people tend, and this is how I tend to conceptualize for the people I work with, but start bringing God into it, is that we all have a relationship with God or the divine, or, that kind of universal thing, however we might conceptualize. And a lot of that imagining in that relationship is with God is in a protector kind of role. And so when we go through a crisis, when we experience trauma, we then look at that ultimate protector and we feel unprotected, which makes a lot of sense, right? I am going through this, but I am supposed to be protected. I have a relationship with you. Come on, why are you not holding up your end of the relationship? I'm doing my part. And I think it becomes really difficult because it then gives us this sense of like, wait a second, is this a capricious God? Is this a God that's uncaring? Is there even a God at all? So all of this comes up for people. And I look at it again as a relationship, because relationships are not always like this. We can have best friends and we can have disagreements where we drift apart a little bit, and we can come back together too. And that doesn't mean that, oh, we now agree on everything. It just means that, okay, we found our way back together. And so being able to think of that push and pull in terms of what our relationship with God is, for some people can be really useful. I think another part too, this is really Jewish, and we don't hear about it in sermons all the time. We don't hear about it in how we frame our liturgy or how we frame our holidays, our celebrations, or even our remembrances. So there's not a part of the Yizkor service that talks about not just only the named people we've lost this year, but let's also reflect upon the dreams of people we were hoping to meet that we didn't get to meet this year. How impactful would that be to be able to hear yourself in that Yizkor service, to be named, to be recognized in that way, where, oh, wow, this is normalized, right? That we're talking about, this is common, that the rabbi can mention it. And there's power in that recognition. As Bill was saying, we see infertility time and time again in the Bible, especially in the book of Genesis. It is talked about so much. It does tend to be female factor. And what the Bible tells us in terms of managing infertility is you just pray a lot and it'll be gone, which completely disavows the whole idea that infertility is a medical issue. So pretty amazing that the 100% of infertility in the Bible must have been unexplained, because apparently prayer was the answer to it. I'm not saying that prayer is the answer or isn't. Prayer can actually be really, really helpful. So those people that have a really strong relationship and a really strong belief system in their faith are actually helped by that when they go through infertility challenges, because they have already that faith. They have the notion that faith gets tested, and they have the notion of the relationship, and they have the notion too that prayer is something that could be really useful, or other rituals can be really useful. For so many people, going to mikvah is such a beautiful ritual that started to be more incorporated for those that are going through fertility challenges. So being able to say, like, okay, infertility is a really Jewish thing. And within our religion, we have some beautiful prayers, we have some beautiful rituals in which to heal that part of us too, in which to strengthen that relationship between us and God, where we can question, what you thinking about here? This isn't fair.
I also want to say one of the beautiful things is that we're here tonight, and both of you have been really a big part of that normalization and talking about this. Because when I think of many other traumatic events in life, many other mental health crises that we may go through, some of them are more or less represented in the Jewish community, or we know of organizations to go to, so we recognize it happens. And having these type of events, and you're speaking alone, makes that invisibleness of it, that unseenness, which I think is what's really hard, is is it Jewish, is it not Jewish? If we're not hearing about it, it feels like we have this big separation. And also, I just heard Art Green speak recently, and I'm probably not going to do service to exactly what he said, but what you just mentioned about prayer is, he had said, if we come to prayer and expect that there is like an answer, we're not doing it right. Like that actually the encounter with God is not through an exchange. The encounter of God is through the act itself. And our bringing out these words is actually what is what enlivens God, is our process of spilling that out, of our requesting and that. And I just thought it was really beautiful, because I find that for a lot of people, that avenue in Judaism and that theology, that disconnect is very real all around. So speaking of that though, because I was thinking about so many people who come to me and they're like, what do I pray for? What do I do? I do also want to address some of the questions that people have brought forth, and when they are asking and when they are looking for help. And one of the questions that we talked about is when someone may have experienced a loss, directly a loss of a pregnancy, but also maybe just the loss of a cycle or a failed try another month. One of the questions is, how do I know when I'm healthy enough that I can handle to try again? to get back. Like we often tell people sometimes it's okay to take a break, but for many people, how do we make the decision? How do I know that I can handle this to try again? Can you speak a little bit about that? When to know we're healthy enough to continue or keep trying?
What I tend to tell my clients is, like, if you think about a scale here, and this, because typically what holds us back in that situation is fear that this is going to happen again, fear that I won't be able to manage it if it happens again. So if you're looking at a scale where one side is, I want to have a baby, and the other side is, I'm terrified this is going to happen again. When that baby part, even the most slightly, starts to hold more weight than the I'm too scared, that tends to be when I say to people, okay, then go think about trying again. When that hope, when that dream kind of takes over, and even if it's just the most incremental amount, that tends to be when I think that people have it in them where they can try again, because every attempt is an attempt at, and it's a manifestation of hope. And so I don't think we think about it in that way, that every time we try, that's a manifestation of hope. Because why would we bother trying if we don't think that maybe this time it will work? So having that framework and looking at it as, okay, when my hope is a little bit more than my fear, that might be a guideline for people.
I like that a lot. And it's true that people will ask, when is it okay for me to do this? And of course, the answer is, I can't tell you, because I can't be inside of you and know exactly how you think and feel about this. But having some measurement, and I like Julie's metaphor, I think it's really good. The scale, you know yourself better than anyone else does. Even your partner doesn't know you as well as you do. And I think sometimes we miss some of the resources we have within us because we haven't had to call on them, and that pull gets just a little bit stronger, and we say, okay, I can do this, or I want to do this, or I'm willing to take the risk to do this, because if it works, the reward will be what I've been hoping for, and I'm willing to put my hopes out there.
I'm just actually, by the way, thrilled to hear your answers. A lot of we get that question a lot, and that is often the approach that we have taken in that too. Although sometimes I say pain versus fear, it's really real. Another question that came in that kind of follows up on the heels of that is, someone said, how can I pick myself up after one of these setbacks? That was a question.
Do you want to start, Bill, or should I?
Carefully.
Yeah.
I think that's the answer. Carefully. Do not force yourself to jump back into something if you think it's going to be difficult to do. None of us in our profession would want our clients to do something which is going to be damaging to them. For many people, for everyone, there is a point when you say, I will not do this anymore. And that is okay, to give yourself permission to not do whatever it is anymore. It's going to be more for some people and less for others. And there are going to be multiple factors which will determine that. Julie alluded to, if you live in a state where there's mandated insurance to cover IVF and you've got it, you're likely to go further than if you don't live in a state with mandated insurance coverage and your economic situation doesn't allow you to go further. So that's just one factor. You may live somewhere where access to care is limited, and that may be one factor. There are multiple things. Usually these decisions are multiply determined. Lots of factors go into them. Including going forward for the next cycle. I mean, maybe you do need a rest. Maybe you do need a week or two off, a month or two off. Maybe you're afraid to take a month or two off because the clock says you're a certain age, and if you don't go further, the statistics say that your probabilities of success go down. That would be true.
Yeah.
But it's I think, a very personal decision.
I think another way too of looking at it is that when we start getting on that infertility merry-go-round, which sort of goes round and round and round, and it feels really hard to get off, even to take a break, or, you know, getting off it feels like we can only do that when we have a baby. And that starts to take over how we see ourselves, that we start to see ourselves more and more, that percentage of ourselves where we might have had all these different identities that we were in line with and aligned with. And when we start going through infertility, we start to see ourselves as a patient, and we start to see ourselves based upon the schedule of what treatment looks like. And of course that makes sense. But then what tends to happen, sometimes quickly, sometimes slowly, is we shed all those other things that also used to bring us joy. So one of the things I like to say to people is, what can we do to nourish yourself that has nothing to do with fertility? What are the hobbies? What are the things that you enjoy? What are the things you might want to learn that has nothing to do with scheduling appointments, that has nothing to do with shots, that has nothing to do with coordination, that, you know, that's just something that's going to fill your life with some joy? Because we forget that life is multifaceted when our eyes are so focused on, let's just get to the end, let's just have a baby, and we just got to be really, really drawn in that one direction.
Well, I just have to say, by the way, I almost could like put a plug in for our spiritual care. Absolutely. Like in our spiritual care, this is like meaning of life that we would talk about. We can't think that the goal is the baby, that we have to recognize that part of the fullness and the wholeness of our life is recognizing the fullness and wholeness of our life. And I do think that that's a large part of picking yourself back up to be able to say, because there is more to this. This is hard right now, and there is more to me in filling in. I just want to recognize the time and know that, like, I have other questions that people have asked, so I'm going to try and get a couple in if we can do a quick fire round of questions. Maybe I'll let you each answer one question. How's that? So one of them is, and I think this one really, this just came in because someone just said to me recently that couples therapy is almost kind of like a higher level because of the complexity of it. Someone said that to me recently, and I was thinking about our discussion earlier, and someone wrote in saying they're very frustrated because their partner doesn't seem to want it as badly. And no, it isn't true, but it might just be the panic and the urgency, and there's very support, but how do you deal with that frustration? Pick which one, and then somebody who's going to pick who gets the next one.
Bill, I'm gonna think that you can answer this one really well.
Thank you. So it's important to recognize that each person in a couple is going to deal with this differently. That's just by definition because they're different people. And I think you start thinking about these things in terms of how can, from a professional point of view, how can I help two people see things from the other person's point of view so that you understand why you might be less emotional about this and I might be more frustrated about it. You might be more problem-solving approach. We're going to do this, and this, and then if we don't do that, then we'll stop. Versus my heart aches, and I want to heal that pain. That there's probably something useful in both of those perspectives, and so we would be working with both people to help them gain something from each side. It's really hard to convince somebody to think differently than they do just because you think your thinking is a better way to approach it. It is easier to see the value in someone else's thinking so that they can learn to see the value in yours and reach some sort of a consensus. I think, there's a strength in being able to deny something, which sometimes allows you to go forward. There's also a strength in being able to express how you feel about something, because it taps into a different part of your spiritual self, your emotional self. The key here, I think, is that there is no right or wrong way to go about doing this. There is the way that each person, each couple figures out how to do it that works for them. So for some couples, 27 cycles may be no big deal. I'm saying that ludicrously. And for another couple, we've decided one cycle. If we can't do it in one cycle, to take the Jewish perspective, we are here to engage in tikkun olam, repairing the world. And the way that we repair the world is not always the same for every couple. So placing a child in it may be one way, but helping children who don't have a home may be another way. Our job is to start the task. We don't have to complete it. Obviously, you can do the Talmud better than I can, Rabbi.
For sure.
Okay.
Really beautiful. It is not upon us to finish it, but we are going to see if we can get one more question in here, because I, by the way, have many more questions, and this topic is so rich, and it is not our ability to discuss everything about mental health and infertility, but a really good way to end, kind of taking one step out, is because we have some people in here who are going through this, some people who have been through this. We also have some people who are watching someone else go through this. So one of the other important questions is, how can I be supportive to someone else? I think it's a beautiful question, because we need to recognize the boundaries of others. And this could be the case for many mental health issues, but especially we're talking about infertility. How do we help someone who's going through this?
I think part of how we help them is we are very, if that person has shared with us, then we can have more direct conversations. If somebody has not shared with us, asking probing questions may not be experienced as very helpful. So I think part of what it is knowing your audience, knowing who it is, that person. Are they someone that they're open and they can share? For most people, I know when my clients are like, oh, I've shared with all these people and now they keep on asking me questions. One of the boundaries we talk about setting is, why not say something like, when there's news, I'll let you know. And so respecting that, to say, yep, they're going to let me know. I might be really curious, but it's my job to hold on to my curiosity, to manage my curiosity. And it might be, hey, let's spend some time together. Let's go on a walk. Let's do things that are not going to be child or baby focused. Mm-hmm. I think that can be a really useful thing. It might be that if somebody has experienced a pregnancy loss, it's, I'll bring over food, or I will do this, versus how can I help? Because so often we don't know what we need. We feel just so overwhelmed that it's really hard to come up with that. Well, let's see, I need the laundry to be done, and I need this, and my dog to be walked. Like, we don't necessarily know that. So being able to say, I'm going to just drop off dinner and you can freeze it if you don't need it tonight, not a problem. But here, I'm thinking of you, I'm going to drop this off. Or even just texting as a, hey, thinking of you, with a very low stakes, like, you don't need to respond to me because I don't need that of you, but I do want you to know that I care. And so I think sometimes to be supportive means that it's not going to be as bi-directional as we might be used to our relationships.
I'm wondering if it's possible, like, this is just one of the things, like when you said about for someone to be able to say, I'll let you know when there's something there. Do you think it's possible to say, this is totally a loaded question, but to say to someone, I understand you're having a difficult time, and I love you, and I trust that if you need something, you will let me know, and I'm letting you know that I am here, and I will respond in any way, and I'm going to trust you to reach out to me when you're ready and if you need it. Is there, because I think that part of it is the onus often is put on that person to ask, and I'm wondering if there is any language for someone trying to show support. So I'm just pushing that back in as much as,
it's a really hard question to answer as, in all circumstances, this is what one should say. So I think there are circumstances where you can say, I love you, I want to support you, and I also recognize you might want some distance. So I am here, feel free to call on me. But I know from being in those trenches that the energy it takes to call on that person can sometimes feel really overwhelming, or it just feels like a lot. And then there can be that fear of, but what if they're busy? Or what if, they meant it at the time, but now it's 3 months later and they forget? Or so I think in that way, it's hard to put the onus on the person that's experiencing the pain. If we look at, there's a fantastic model by Susan Silk that's circles, and that center circle is the couple that is grieving, or the person who's having difficulty. And in all the circles outside of that center circle, the idea is that help has to come inward. If that person in the middle is starting to comfort out, they're not getting what they need. So the idea is comfort comes in, comfort doesn't go out.
So in that regard, is it okay then, like you said, it's better just to do, and I'm pushing on this just because I am wondering if it is okay then to kind of have the unsolicited, just bringing this over for you, just letting you know I love you, sending you a message, because like you said, we don't want to say, no, when is the baby coming? And I'm pushing on this just because I want to make the distinction, and for people to hear about that. We often tell people what not to say. So I want to push on, like, what are the things that we can say and do that we think don't go into the bursting their bubble in that circle, but are supporting that circle.
Well, so sorry, Bill, go ahead.
I was going to say that I think your words were beautiful. And when I heard them, they resonated in a positive way with me, but they might not with somebody else. And so in a friendship, hopefully you know your friend well enough to know what works. And if you don't, then maybe you say something very non-specific, like, I know you're struggling, I'm here for you in whatever way is useful, and don't feel as though you need to ask me for something, or some very, very general kind of statement, just to say, to be really trite, I feel your pain. And when and if the time is right, please feel free. Go ahead, Julie.
So of ideas that I'll put out there. One, and this is more specific for pregnancy loss, but if you can write on your calendar, add it to your iCal calendar as an once a year recurring event, it's really meaningful when a year later somebody says, I imagine today might be kind of complicated for you, and I just want you to know I'm thinking of you. Because typically with pregnancy losses, the only person that remembers is the one that experienced the pregnancy. Oftentimes partners don't even remember. So that's something that I would say for that situation. Another thing, I have a friend that is unfortunately going to be dying of cancer, and she is in sort of these last rounds, and she's put out a blog because it's overwhelming for her to have all the people that love her, and there's so many, to say, what do you need? What can we do? How do we help? So she's put out a blog. How are you feeling? She's put out a blog that lets us know what's happening. And in it, she's got an Amazon wish list. And in it, she's got a very good friend's phone number that says, this is the person who's coordinating. So that might be another way too of setting it up, is that if you're struggling, do you have a close friend or family member that can be your point person, so that well-wishers and well-meaning people can go through them and take the burden off of you, that you can say, you know what, there are a couple of books that I think might be really helpful right now, but I can't go there. Or, you know what, it would be great if a couple of people could bring me meals. Or, you know what, I don't have time to bake challah this week. That would be lovely if someone could drop off a challah. I'll keep it Jewish, right? But those kinds of ideas might be really useful in terms of what can you do that's proactive. But I think part of it too is we're having to then to shift how we look at comforting the bereaved and what is the bereaved responsibility in that. You're muted,
I think that's part of the reason why I wanted to ask the question, because it really depends on the person. And it's one of the most common questions I get that comes up in terms of support. It's how much do I ask for? And then someone's like, but I don't want to ask, because there's also sometimes this, again, as we come to the end, some people do have that shame. Well, but it's not that, it's not this, it's not that, I'm just going through this, and they don't feel that their pain is legitimate. And it's figuring out how to get the support we need. And then it's on the other side too, when some people are like, look, I know someone's hurting, and yet you don't want to interfere. So this is just a really common thing, which I think compounds. A lot of times I think mental health issues get worse through isolation. Yes. And it's ironic that both sides can be afraid to connect. So I do think that this is just an important thing. And I'm really grateful for your advice, because I hope that it expands everyone's thinking to recognize that there are possibilities on both sides to seek help and to seek ways to support, which is a beautiful way to end this. I really do think that I could keep speaking to you for another half an hour, but Julie, you have something you want to add?
Yeah, I just wanted to add one thing actually that I've started to see more and more that friends are doing for their friends. So friends that are going through fertility challenges, or friends that have had pregnancy losses, will enlist friends to help find them the mental health professional that's got availability. And something like that can be really useful to doing that legwork for someone.
I also get calls. I'm really happy to say that there was, we have some people here today that is their role, and they call Hasidah to find out what are the resources you have and what can I do to help. And sometimes that's also people just call and prepare. It is a beautiful way to support someone else. And that can be something asked, it can be something offered. Can I look for those things for you? I see that Ariel is starting to do our closing things. We do have, would encourage everyone here, both about infertility and about mental health issues. Earlier, we posted about arsrm.org. We also have Hasidah.org for the Jewish and challenges in fertility and other family building issues, as well as No Shame on You for issues in mental health, both about infertility and the fact that we recognize some people may come in already with those issues and may leave and go beyond. So we want to make sure that everyone sees all of those resources, which are being posted for you. I want to thank Bill and Julie, just brilliant. There are reasons why you are experts that we turn to. I'm very grateful for all the work you do with us tonight, and for everyone who I know that comes to you, and for bringing this into the Jewish community to share for this. So thank you everyone for attending. If anyone does have further questions, please feel free to reach out to any one of us, and we're happy to connect you with whatever resources we can do. And with that, I'm going to, we have, if anyone wants to put that in there before we close in the chat, we can send that out to anyone participating. And with that, I want to say thank you and good night.
Thank you.
Thanks so much.